Welcome to the Nurse Residency Program, Searching the Evidence. This is your evidence-based practice module. I am Dana Bush, Clinical Education Specialist for the System Education Department. I'm a level of educator for the Emergency Department. Our outcomes today are to review the key concepts associated with evidence-based practice, draft a PICOT question, utilize available resources, and critically appraise research studies. For our disclosure, there's nothing to disclose. You get 3.5 contact hours, and there's no conflict of interest. The outline for today. What is evidence-based practice, also called EBP? What are steps of EBP? What are some models we can look at? What are barriers? How do we look at evidence? And what should we do next? First, let's talk about the timeline for projects. For the January cohort, you will have your PICOT question due in approximately 1 month. And then you'll do your final presentation approximately 2 weeks before graduation date. You'll get those dates from Brenda Potter or your clinical education specialist. For the June cohort, you have approximately 5 months to get your PICOT question in. And again, you'll have a final presentation that you'll record and turn in approximately 2 weeks before graduation day. Now let's look at some advice from previous nurses who have attended nurse residency.
Pick a project that you can take further. Don't be an autopilot.
Pick a project that you really care about, something that you're going to be invested in, and be prepared to be patient.
I would say that you need to find something that you're passionate about, and that's going to keep your interest, not just during the process of doing the project, but even afterwards if you want to carry it out and get it put into practice.
To get together with a group and just come up with questions and answers, and because it doesn't take only one person to come up with what's best. It is wherein a lot of nurses come together and give their input.
My biggest advice would be to start early. Don't procrastinate. Talk with your peers, even if it's just kind of like throwing out ideas you don't know might have enough information. And that's the benefit of starting early. You can, research a little bit to see the amount of information that's out there, and if you need to change your idea, then you've got enough time to do so.
I would probably say don't procrastinate. It's easy to just make a list of the things you need to do and divide it up with your group and make sure everyone is on the same page about it, and it doesn't take too long to do that. So
I would find some research, make sure that you have enough research to support what you're talking about.
Okay, let's talk about the presentation. What's the outline look like? So we do have a template for your PowerPoint, but as long as you have the outline, you can make the PowerPoint yourself. Your first slide is going to be your topic and the group, so everyone's name is going to go on the first page. Second slide is going to be your PICOT question, and it's going to be broken out in your PICOT. Then you're going to have anywhere from 3 to 5 articles that you're going to present to discuss your PICOT question. So on those articles, you'll have the title, you'll have the author and the year, the level of evidence, and your key points. Then you're going to have your recommendations as well as your next steps. The next steps is optional, whether you include it or not. You're going to include a slide that says questions and include information on how someone could contact you if they do have questions about your project. And then your last slide is going to be your references that you use to create your presentation. I want to show you an example of an EBP project. This is Emergency Department Aggression Rating Tool, also known as the EDART. I'm going to show you their presentation and what they presented in nurse residency. Their very first slide looked like this. They called it Assessing the Acute Behavioral Disturbance in the ED Patient. These are the people who were listed that presented that day. Then you have their PICOT question. Patients, the population is patients with acute behavioral disturbances in the emergency department. Their intervention was the use of a behavioral assessment tool compared to the use of the inpatient Riker score in the ED. And the outcomes they expected was improvement of staff and patient safety and decreased staff violence. Then they went into their articles. So first they talked about evidence of violence in the emergency departments. And it talked about all the different violence that's happening, and it described them. So in that third bullet, it talks about where the nurses are being spit on, hit, pushed, shoved, kicked, scratched. Could you imagine having that behavior on a regular basis? Well, that's what the emergency department has to deal with. So at the bottom of their presentation, at the bottom of their slide right there, they have the authors, the year, and the level of evidence. We'll discuss the level of evidence soon. Then they presented what is current practice right now at St. Luke's. Current practice was using the Riker Sedation Aggression Scale, and they discussed what it is. It was created to assess the level of sedation for an ICU patient, and that really wasn't an appropriate tool for them to use in the ER for someone who was drunk or some other hallucinating from medications or street drugs. Anyway, here they have again where they got their reference at the bottom of the page. Then they go into another article. Emergency departments need an assessment tool. And it talked about violence concerns, and it talked about different types of tools and the lack of tools available. And it also talked about risky behaviors that are seen in the ER. Here again, they have their level of evidence, the author, and their year. Their next article talked about sedation assessment tools to score acute behavioral disturbances in the emergency department. Here they introduced the idea of using this SAT, so the sedation assessment tool. The SAT is used like in Australia. It's not even used in the United States. However, there wasn't anything in the United States at all. And it talked about this very subjective type of tool, but it was the only thing they could find in the literature. Here's their reference, which is the author, the year, and the level of evidence for them. Then they put on the next slide actually a screenshot from that article that showed what the SAT assessment tool looked like. And they talked about how objective it could be, or subjective, from the subject. Again, they have their level of evidence and their resource right there at the bottom. Then they go into recommendations. They actually had two recommendations. One was to adopt the SAT assessment tool that was used in another country, is not being used in the United States at all, or create an emergency department specific behavioral assessment tool of our own. Then they had a slide with questions. So they asked the audience if they had any questions out there. For you, since it'll be recorded, if you have any questions, who to contact needs to be on this slide. And then their last slide, of course, was their references. So here they had 5 references for their presentation. So to begin your project, you have to have a PICOT question. So today we're going to talk about what is a PICOT question. So you have to ask the right question in order to get to the right presentation, to the right project. So P is for population, or it's people, or it's the problem. So it could be, what kind of problems are you seeing in your patient care or in your patient population that you're looking to fix? I is intervention. What kind of intervention would you like to do that you got from the literature compared to what we're doing now? And then O is outcome. So from the outcome, what would you expect? What would you expect to happen if you were to do this new intervention? And then some people include time as part of the PICOT. So by when would they have this completed? So let's practice a PICOT question. Think about the literature. You want to review a lot of articles from your library, and then you also want to think about what you're going to recommend. So when we practice a PICOT question, let's think about this. Do you ever think about, does it matter if we sit or stand when we take care of our patients? And so if you were to go to look at the literature and start analyzing it, what would you find? Your PICOT question might look like this. Your population are hospital patients. Your intervention is sitting while talking to the patients within the first 60 minutes of patient care compared to always standing while you're in the patient's room. And the outcome that you're predicting would be improved patients' perception of quality of care. We're going to practice some PICOT questions. You're going to go into your small groups, and we have 4 different scenarios that you're going to practice, and each one of them have a few articles that you're going to discuss, read them and discuss them, and come up with a PICOT question in your small groups. They may not be the exact same statements, may not be the same thing that represents P, I, C, and O. When we come back, I'll go over some possibilities for the PICO questions. So go ahead and stop your video and go to your small groups to do these exercises. And I'll see you when you get back.